Hello, I'm Elle, one of the estheticians here at Antiage.
I'm Sarah, one of the other estheticians here.
And today we're going to be talking about some of our Sciton lasers like the BBL, Moxi, and Halo.
We also have two new lasers that we've added on that we can talk about in the future as well. We have the TRL, which can be a very gentle laser resurfacing or more aggressive depending on your desired outcome and downtime. And then we also have ProFrac. All of these can be added onto any of our other laser treatments as well.
Yeah, so we're actually going to be doing a little bit of the BBL treatment today on Nataleigh, one of our other estheticians. But BBL is broadband light. It's similar to IPL, but Sciton trademarked the BBL broadband light, and it actually has more anti-aging properties. It's a little more comfortable than your traditional IPL, and it helps with pigmentation and redness in the skin. The downtime is pretty minimal. We just want you to stay out of the sun 2 weeks before, 2 weeks after treatment. But you're free to wear makeup right after. It's a fan favorite.
The other neat thing about BBL is that there is a collagen pass that we do before and after we're treating your browns and your reds in the skin. So that's going to help with collagen therapy as far as the epidermis. So think texture of the skin minimally. We have Moxi, that's our laser resurfacing. That's actually really, really great for texture concerns like fine lines, pore size, acne scarring even, phenomenal treatment, minimal downtime, a great way to kind of tiptoe into laser treatments, and it's safe on all skin types.
Yes, I actually really love that treatment for patients with melasma as well, because a lot of lasers you want to be careful with when treating melasma, so I want to put that out there that it's a great treatment for melasma, which is awesome.
I personally have melasma and can't do BBL because it's too triggering for my type of melasma that I have. The light therapy of it causes it to flare. So Moxi, I've had a couple sessions now, and it's really, really helped to reduce the pigmentation that bothers me that where in the past I couldn't do laser like BBL or IPL for.
For someone who's looking to do something a little more aggressive than a Moxi, we have the Halo, which is ablative and non-ablative. So similar to the Moxi, where it's going to help with texture, pores, some fine lines, everything surface level, and give you that nice polishing, but it's also going to target deeper into the skin to treat more of the signs of aging, more of those fine lines and wrinkles, get that collagen stimulation, but also patients who have acne scarring too. It's a great treatment for that. A little more downtime with that one. 3 to 4 days of redness. Some people do have that swelling, but still pretty easy. And all these treatments, I'd say, are pretty tolerable for the most part too.
I am a big baby when it comes to heat-based therapies or lasers, so I can say with numbing and our cryo cooling, the Zimmer machine that you blast the cold air out, completely comfortable. And honestly, downtime with BBL, Moxi, Halo is not bad at all. We can customize it to the person's desired needs, but also to the downtime that they're willing to take. You may need to do a few extra treatments if you don't want as much downtime, but it's very, very customizable.
That's another thing. We do like to do these treatments in series. If patients are we'll pick a laser that will best suit your needs, but we'll usually do a series of 3 to 4 of these lasers to really get in there and treat the concerns, and we like to space them about 4 to 6 weeks apart just so we can keep building on top of those prior treatments.
Another fabulous thing that people don't realize is we can treat anywhere. Face, neck are the most popular, backs of the hands, chest are kind of the second most popular because these areas are a little bit thinner skinned and they do show our age faster. We can do the body though. Like she was saying, we're going to do BBL in the arms. I've done full BBL on people. We've done Moxi, Halo, all of these treatments you can do for crepey skin above the knees. You can do it for pigment on the legs, the feet, literally head to toe.
We have Dana asking, are all the lasers the same?
No, they're all different wavelengths, and they are treating different concerns with the skin. So BBL, that's mainly going to be for the sun damage, the brown spots, pigmentation of the skin, and then vascular, so rosacea, broken vessels, things like that, and does stimulate collagen, which is also nice. And then the Moxi, that's going to be it's a light resurfacing laser, so think of that good smoothing and polishing. If you have skin, you probably need a Moxi.
I love it when you say that. It's cute.
Pores, pigment, texture, some fine lines, and then the Halo, that's going to be the more aggressive one. So more of the signs of aging, a bigger collagen boost, but also focusing surface level, like I said a little bit earlier, but going deeper down as well.
One of the great things about Antiage is that they do invest in the latest and greatest technologies. So literally in the last year, we've gotten BBL, Moxi, Halo, now we have ProFrac and the TRL. So we have a plethora of different lasers that we can do based on the ethnicity of the skin. We have to be cautious with that with lasers, with some of them. Your concern, whether it's crepiness in the neck, pigmentation, so they can be customized to your needs and your downtime.
It's amazing because we can go mild or we can go totally aggressive. So we have all the tools.
I literally had a treatment the other day where I did a very mild treatment on my face because I didn't want that much downtime, but we chose to go more aggressive around my eye area because that's where I'm starting to see some of those signs of aging more than I would like. And the downtime, even going more aggressive on the eye area, just because we customized it to that area, was very, very easy.
Yeah.
Any questions?
And all of those who are joining now, we do have a giveaway. Ask us questions during this live event and send us a DM with your name, number, and email to enter for a chance to win 60 units of Botox.
Woohoo! That's Botox, awesome. And that's another thing too, is like a lot of people think, oh, I'm just gonna get Botox and filler and focus on plumping up my skin, smoothing out the wrinkles. You really need to do the whole shabam. I say skincare, injectables, and treatments in office, whether it's lasers, microneedling, or facials. You're gonna get the best outcome that way. Who wants plumped up, leathery skin or like super sun damaged skin? Then it's more obvious that you've done injectables, and it's less detectable, I feel like, when you're doing everything right.
I totally agree with that. I feel like a lot of patients, they start with either skincare or injectables, and we'll kind of show them everything we do, and I feel like they begin to realize, like, oh, it is a little bit of everything, and it kind of goes hand in hand, which is great.
We have another question. Is BBL better than photofacial?
Yes. Yes, because BBL not only targets browns and reds in the skin, like Elle already said, sun damage, brown spots, freckling, rosacea, veins, cherry angiomas, but it also is giving you collagen stimulation too. There's actually a Stanford study that came out last year, I believe.
This is amazing.
Yeah, saying that it can actually kill precancerous lesions. That doesn't exclude you having to go to your dermatologist yearly for checks, but it is not only an aesthetic treatment, it is also healthy for your skin too.
Yeah.
And another question, what skincare do you recommend?
Everyone's a little different. I love the ZO products. I'm a ZO girly, but I'd say it's best to come in for a consultation so we can really see your skin, see what would best suit you, your concerns, things like that. Because it's a customizable approach for all the skincare we carry. We have a little bit of the ZO products, we have Skin Medica, some SkinCeuticals, some of the Anfisa products as well, Elta sunscreens, kind of have a little bit of everything.
Yeah, I think the medical grade skincare though is very important to get the optimal results. I always tell clients we're not trying to like push this hardcore on you, but it is going to maintain your results from the treatments you do in office, like BBL and Moxi. It's going to make that result last longer for you. It's a protection in your investment, basically, especially the sun protection aspect of it.
Can you treat darker skin?
Yes. Depends on which laser. BBL, typically we won't do certain skin types, like African American skin we can't do with BBL, but Moxi we can definitely do. We have quite a few different options for skin of color with lasers.
How long are these treatments typically?
They range and kind of depends. Like, we have people coming in, they want face, neck, chest, maybe some other body parts, but for face, I'd say BBL, we do book that out by the hour, just so we can really go in there and address all the pigment concerns, all the redness concerns, make sure we get those collagen passes in there. The Moxi, you do numb for this treatment, so it's another hour appointment, but half of that is pretty much numbing time, and then the Halo, that's going to be about an hour, hour and a half, depending as well. I'd say about an hour and a half for full face, and you just numb a little bit longer for that one, and the treatment's a little bit longer because we're going a little deeper. We're going surface level and a little deeper into the skin since it's ablative and non-ablative.
And obviously treating more surface area, if we're just treating your face versus face, neck, chest, or full body, that's going to depend on the treatment time too. But if you do have specific questions about what you're wanting treated, we can obviously let you know what that would be.
And everyone watching right now, remember, call us to book your appointment anytime this week and next week to get 10% off your laser treatment. And we have another question. What is the typical downtime?
So this does range. I'd say BBL is typically the easiest. Afterwards, you may be a little pink. Some people are, some people aren't. Some people will get swelling. I'd say that's not very common. I don't see that a whole lot with BBL by itself. But if you have that pigmentation, brown spots, sun damage, you do notice that peppering. Kind of looks like coffee grounds on the skin. The pigmentation essentially darkens, and over the course of a week, you can have that kind of flakes off. But what's nice is you're able to, if you do want to, you can wear makeup. We just ask that you keep your skincare light and simple, just nice and hydrating, no actives. But we do go over all that with you in office. I'll let you talk about the Moxi.
As far as like Moxi or Halo, that downtime depends on how aggressive we're getting with your treatment. It could be just honestly the next day after you've had it done, that sunburn look and feel is gone. Some people will have that sunburn look and feel for 2 to 3 days depending on how aggressive we get. So again, we can customize it based on your needs for your desired outcome and your lifestyle. Moxi and Halo, you get what we call mends. They're just the microscopic injuries that the laser is laying into your skin. They kind of look and feel almost like a fine grit sandpaper, and those will gradually slough off over the course of 5 days. Typically, some people, if you take a little bit longer to heal, if we want more aggressive, they might have, superficial mends on the surface around the perimeter of their face, day 6, day 7, but not too bad as far as the downtime goes. It just looks like kind of dry, sloughing winter skin, or if you've ever used too much retinol before, that's kind of what it looks like.
I'd say like the most crucial for like Moxi, it's probably like the first 1 to 2 days where you more so have that redness. Halo, sometimes it's 2 for some people, sometimes it's 3 to 4. Everyone's a little different, but really after that you just have that rough sandpapery texture for the remainder of the week, and it's so satisfying having that slough off, because each time you clench you can kind of notice it slough off a little bit, and that fresh like baby skin's underneath. I love it.
How long would recovery be for a male over 50?
It depends on the individual, how healthy their skin is to begin with, how aggressive we get, which treatment we get as well. Typically we have male clients that come in and do treatments on like a Wednesday or Thursday evening, and they're fine for the weekend to do stuff. It just depends on how aggressive we get and which laser we do.
Are lasers better than prescription skincare?
It's different, I'd say. I think having the combo is great because we can only do these treatments ideally, like we space them out 4 to 6 weeks apart, so the rest of the month you're doing that home care and skincare. So I feel like both of them make a difference, in doing the like medical grade prescription at home like enhances your results essentially,
and it prolongs those results too. But you have the power every day to touch your skin twice a day with your skincare, so that really can make your results in office better and vice versa. So it both go hand in hand together, the same way I just said, lasers, treatments in office, injections, and then the physician grade skincare really is going to make a big difference for you overall.
Okay, and so now we will be doing a live demonstration of the BBL. We have our esthetician Nataleigh here.
Hello, hello.
And she actually just did the Halo on Monday.
Yes, on Monday we did face, neck, and my chest area with the Halo. We also did the ProFrac around my eyes. The ProFrac is the fractionated erbium laser. That's going to help with some of the crepiness and just hopefully help tighten that top upper eyelid. As far as the BBL, I have some brown on my arms that we're going to treat. Take my watch off.
Do you want me to do this collagen pass too?
Whatever y'all want to do. Got my glasses.
Do you have a drink we can put over her or anything? Or? Pretty good.
I don't care. I wore this on purpose for.
Okay.
And reminder for those of you joining, call us to book your appointment anytime this week and next week to get 10% off your laser treatment.
Okay, so first we're going to start by doing the collagen pass on Nataleigh, which is really nice for like a lot of women come in and they don't like the crepiness of their skin right here or here. Getting older is so fun, so this is going to help with that quite a bit. I'm just smearing the ultrasound gel around on her skin. It's going to protect the skin. It also makes it a little bit more comfortable, in my opinion.
Are you treating both red and brown?
On Nataleig's arms, it looks like we're really primarily focusing on browns. Yeah, so sun damage. All right, friends, ready? Let's hold hands.
And I will throw it out there. This is the collagen pass, so it's not going to be that spicy. I'm a weenie when it comes to treatments. Usually, for some patients, we can have the chiller blowing on them. It's just cold air that helps. Kind of, one, it distracts you, and it just helps kind of offset that like warm feeling. But if we had that going, you wouldn't be able to hear anything.
Yeah, I personally love this treatment, and I think the collagen passes feel really nice.
Yeah, that actually doesn't feel bad.
What setting that you want me to
Do you
do?
remember what we did before when we were playing around? Do 7. Do a pass. We'll see what happens.
That's
This is
right.
it.
Reminder that we're also having a giveaway, so ask us questions during this live event. Send us a DM with your name, number, and email to
See if it can
enter for a chance to win 60 units of Botox.
All right, so now we're just gonna do a little spot treatment at the setting we think is gonna work best based on her skin type, her recent activity outdoors. And I'm gonna see how it develops. Usually you can see the peppering start to happen within 5 minutes or so, but then it will gradually darken over the course of the rest of the day, 24 hours sometimes. Thank you.
I didn't feel that.
But if anyone has questions, you can keep asking away. We're happy to answer.
And Natalie, does it hurt?
No, this part actually doesn't. I was surprised because I'm kind of a baby. Going up one can feel it more. Also, as you can tell, I have really dark hair. I shave my arms, and I am due for laser hair removal, so this is going to be killing 2 birds with 1 stone. So to be fully honest, I'm probably feeling it more so because of the dark hair than I am because of the pigment.
And question, how many treatments are usually needed?
About 3 to 4 typically, spaced about a month apart for more of those results off the bat, and that's going to be a month apart every 4 to 6 weeks. And then after that, I feel like people will maintain and do a few year. It really depends on lifestyle. Some people love spending time outside, so I feel like they'll come in a little more frequently. But for some people, they're really diligent with the sunscreen, being cautious of the sun in summertime, but it depends on lifestyle, I'd say.
For before and after photos, you can check them out on our website, antiageinstitute.com, or on Instagram. We will post them periodically. If you want any before and after photos, let us know and we can send them of each treatment. Someone said, I just joined. What is this procedure?
So we are doing a BBL by Cyton, that stands for broadband light. So if you're familiar with IPL photofacial, this is the intense pulse light. It's a little similar to that, but it's a little more effective, and you also have more collagen stimulating properties to it because we do collagen passes as well, so it's a little more anti-aging. But right now we are picking up her pigmentation in the skin, any sun damage she might have, so those brown spots. But we can pretty much treat anywhere on the body. So some people will do their face if they have avascular, like rosacea, broken capillaries, vessels, things like that. We also treat those concerns as well.
Sometimes I'll do the plastic. No, you're fine. Just playing around with it.
And then also for our patients, we do normally have our Zimmer chiller in here. It's a basically blast cold air at you, so that does help with making the treatment more comfortable too, just so you guys know.
Are you able to be in the sun at all between treatments?
Not recommended. In theory, this compared to the photofacial, you don't have to be as cautious. But if you're treating brown, you don't really want to go back out in the sun and get more sun damage. So this is typically something that you do, especially on the body area in the cooler months. So think like fall, winter, very early spring. I'm not going to be out in the sun for a while. I do bike ride, and I normally spray tan, so this is a good opportunity because moving forward, I'm probably not going to be able to do anything else until the fall. But I've been wanting to do my arms, so here we
I
are.
do recommend to clients a lot of the time you can get like the fishing shirts that have the UPF fabric in it. That is protecting your investment, your time, your money, and it's also better for your skin. You're not going to get that collagen breaking down as much.
But you don't want to do these treatments when you do have like you have that tan, that fresh color to your skin. That's why fall, winter, it's an ideal time.
Hey Nataleigh, can you show us your face from your treatment from a few days ago?
Yes, I can.
What
Let's see.
did we do?
So we did the halo. I did very aggressive settings on my cheek. Most patients would probably still have more. I'll get a little bit closer. Like the forehead is what most people's cheeks would look like. We wanted to try out some new settings, so we did go more aggressive on the ablative setting. Moving forward, I probably won't do it again, just because there's not really a need for it. But it was exciting to give it a try. The ProFrac around the eyes, honestly, I was expecting it to be way, way harder, but that was probably one of the easiest parts, and I'm excited to see the results. I'm actually really excited for my chest.
So I've never done this one before. The body.
Yeah, you can go faster. So
Yeah.
yeah. Oh, whoa, that's fast.
Yeah.
Okay. So if you want to, you can go up to 8.
Okay.
Let's see how it feels. See if you can, because you okay? Yeah. I just didn't know how you want me to hold my arm. Where do you want me?
Just like that.
Okay.
It's getting slippery. So as you can see, very easy. No numbing needed. Pretty quick. Feels kind of like, how would you describe the feel? A little pop.
Yeah.
Little
You
flash
know,
of
like
heat.
they always say a warm rubber band. It is not uncomfortable. You feel it while you're getting zapped, but there's no residual heat or pain from it. It's not like it feels like much. And honestly, if we did have the chiller, it would be easy peasy. This is still easy, and I'm a huge weenie, so the fact that I'm able to tolerate it.
Just like a pass up here.
No. I'm like, I can't see back there. What do you think? I spent easily a decade in tanning beds. I went to college where I lived on the river, so I have a lot of sun damage. I was obsessed with being tan because I was super fair, as y'all can tell. So all of that sun damage from all of those years is making its way up. And I wish I could go back and tell my 21-year-old self that it's not cool to be tan. It's way trendier now to be pale, and I'm super jealous. But
Embrace your natural skin tone, gals.
yes.
Okay, that arm is good.
Perfect.
Get her cleaned up.
Yeah, that quick and easy.
Any other
I
questions?
don't know if you want to. How's it look?
Reminder that we are doing a giveaway, so ask us questions during the live event and send us a DM with your name, number, and email to enter for a chance to win 60 units of Botox.
Do you want me to just turn that
Yeah.
way, and then you can come around? You get my backside, just for the sake of recording. Walks with me.
Oh man, how old is that?
On Monday. Did I get a treat out last one? Little bruise. Oh, he has to put the back part up, so I don't have to avoid that one.
Natalie's pet rabbit bitter. That's what we're talking about
Yes.
right now. She has a little bruise there,
Yes.
which we can use BBL actually for
yeah.
bruising
For
from
sure.
injections. So if you do get a bruise from your maintenance Botox or any fillers, definitely feel free to let us know if you want a BBL treatment. To help speed up that healing process. Collagen pass.
What is the most popular area to treat?
Face.
Yeah.
Face, and then a lot of our rosacea patients that don't feel like they need to do their full face will just do a partial face for maintenance. When treating rosacea, you definitely want to do 3 to 4, 1 month apart to get it under control. Obviously, like Sarah said earlier, use that medical grade skincare, and then once every 2 to 3 months, depending on how your rosacea reacts in your lifestyle, just to kind of maintain that redness on the cheek areas. Everything tends to be a stressor for rosacea: spicy food, alcohol, heat, sun, living life. So sometimes it's just easier to do, a quick BBL. Plus the fact that it has that collagen stimulation, that it can be like anti-aging, is always a benefit.
What laser is best for the under eye area?
Depends on what we're talking about. For crepiness underneath the under eye area, I've actually really liked the Moxi. So I am super excited to see what the ProFrac's going to do, because we do treat that upper and lower eyelid area. I've had some patients that are darker complected that have like that darkness in the eye area, and they've seen it kind of lighten up a little bit. So if we're talking about like the darkness from pigment, not darkness from like vascularity, once again the Moxi. For vascular type things where you have like that under eye dark circles because of seasonal allergies, or you're tired, or just genetic, that's going to be something you would want to talk to one of our injectors, see if you're a candidate for either under eye filler, PRP, PRF, or one of those other treatment options.
Is there downtime on the nano peel?
What's nice with that one is it's about a day or two of downtime. Everyone's skin is a little different, but I know for myself, I got splotchy about like an hour after the treatment, where my skin was just a little pink in certain areas. After that, I looked fine, and then whenever I went to cleanse my skin that night, kind of got tomato faced again, and that subsided, and same the next morning. But throughout the following day, I looked pretty normal. I just had a little bit of that dryness. Some people will have more of that redness, I'd say, and like I feel like Nataleigh had a little bit more redness than I did.
I think it honestly depends on everyone's like definition of downtime is different.
Yeah.
This isn't downtime for me. For some people, this would be considered downtime. I still went to Pilates this morning just because I don't sweat. And so I was fine. I don't really raise my blood pressure or anything like that. So I felt comfortable working out. But some people, if they have any kind of like noticeable, I did something to my face, they consider that downtime. With the nano peel for me, I tend to get red right here on that upper cheekbone, right underneath my eye area. But I get red after a dermaplane. I get red there after a diamond glow. The next day I'm always a little irritated there. Me and my retinol are in a constant battle. But it was easy peasy. You're just really dry those first 2 days, and then you have just awesome, polished, skin that looks super healthy. It's not dull. It's not going to be very corrective. If we want to be corrective, we're going to go a little bit deeper. Then we can start talking about the micro laser peel, the ProFrac, something like this with the halo. It just depends on if we're targeting more pigment, more wrinkles, and or if it's just a customized treatment where we do a little bit of everything.
That's another nice thing, is we can really go mild to super aggressive. Mm-hmm. Everyone has different concerns, downtime, so we're able to customize that for each patient.
When I have a client that's nervous about the downtime, and they've never done lasers before, I typically am a little bit conservative with their first treatment. Middle of the road. I don't want to say too conservative. You're still going to see results, but that way you can kind of see and get a feel for what the downtime was like for you. Come on this way. And then on your follow-up appointment, because typically you're doing this in a series, then we can get more aggressive based on, okay, that wasn't so bad. I had a little puffiness under my eye the next morning, but I kind of liked it because it pumped everything up. So.
Can you treat puckers, smoker lines, and smooth them out?
Yes, depending on how aggressive we want to go and how much downtime you want, we can do the micro laser peel combined with the ProFrac. We have certain settings that we stay within. If you want to go big or go home, Dr. Laconi has more aggressive settings that he can do. It's just and then there's combination. You can do Botox. And do the laser and do, you know, some filler in that area. It just depends on how much effort you want to put into it, how corrective you want to be. You can do, you know, combination where we do the skin pin too. We can add that on to the Moxi. It's probably my favorite to add it on. I love it for patients that are doing the Sculptra in like the cheek area. You can skin pin afterwards with the Sculptra. For my patients that just want to get a little bit extra oomph and want faster healing times, we can microneedle the exosomes in. And for patients that are doing those PRP, PRF injections underneath the eye, we can skin pin that PRP, PRF into the skin to expedite that healing time, and then they can see an injector to get that injection, so they're combining all of their downtime into one.
Easy.
Easy peasy.
Looks good. Do you want a towel?
And how long have we been in business?
25, 26, 26, 27 years. 1996, 97. It's debatable. One of those. One of those. Yay!
Do you see any peppering? A little bit.
I knew the up here was going to respond better. So fun fact, not all brown spots are created equally. Some of them, unfortunately, especially with the years of sun damage that I have, they like to trick us where they respond to the BBL, but there's actually some texture to them. So they get darker, but they don't necessarily go anywhere, so we have to give it a little extra nudge. This would be something where if I wanted to do the Moxi over it and kind of Moxi over it, do the halo. I'm sorry, I'm not going to take my pants off for you guys, but we did do the front of my thighs to help with like the crepiness above my knees and to help with some of that sun damage on my thigh area, to try to help get those little, basically solar lentiginous sunspots to kind of give them a little boost to get off. But the other brown spots that are just actual true freckles, those will get darker and flake off.
Let's get a
Super
closer look.
satisfying.
Yeah, like so these little guys right here, these are, I need to start naming them, but those are what we would consider like a true solar lentiginous. They did get darker, they got that dusky, they got that clinical endpoint that we're looking for. However, I know them, we've had several battles, and they just want to stay here, so I do need to ablate them. To be fully honest, I just haven't had the time where I want to mess with them. But we do have enough things in our arsenal that I could get them gone. I just haven't. The single spot.
Okay, guys, that's all. So remember to call us to book for your appointment anytime this week and next week and get 10% off your laser treatment.
Woohoo! Now's the time.
Yeah.
Thank you for joining.
Perfect. Thank you.